Hello beautiful mamas and mamas to be, welcome back to my channel. My name is Precious and I'm a registered nurse. Okay, so in today's video I'll be talking about things that you should never do immediately after giving birth. Okay, whether you had a vaginal birth or a cesarean section, your body went through a lot. Okay, in anyone, your body went through a lot, and there are some mistakes new moms make without even knowing, and this mistake slows down your healing, increases pain, and even puts your body at risk. So in today's video, I'll be listing 10 things you should avoid doing immediately after giving birth. Number 7 and 10 are things most moms don't even realize that are dangerous. Okay, so let's dive in. Number 1 is don't ignore excessive bleeding. So after childbirth or delivery, it is normal to bleed actually, yeah, because that is the lining of your uterus shedding off. All right, but what is abnormal is inserting a pad and in less than an hour, that pad is already filled up. Number 2 is if you notice that you're bleeding and your bleeding has some clots in it. Yeah, you might notice some clots when your lining of your uterus is shedding up, but if you notice that this clot is like a size of a golf ball, you know, the ball that is used to play golf, okay, if it's in that size, it's not normal. And also you notice that this bleeding that you're having just keeps increasing instead of slowing down. Because yeah, you're supposed to bleed, but the bleeding is supposed to reduce with time. Okay, but if you notice that this bleeding is not stopping, instead it's increasing, which I assume causes your pad to get filled up in less than an hour, this could be postpartum hemorrhage. Okay, and it's a dangerous sign. It's not a good one at all. It means that you're bleeding more than you should, and if you should continue, you probably will move into shock and something else that could be worse than shock. Okay, so please do not assume, don't overlook, don't say it will stop. It is normal. It is normal, but it is abnormal to bleed more than that level. Okay, call a nurse immediately, call a doctor, get your emergency number ringing immediately. Don't assume it's normal. It is not normal. Okay, so number 2 is do not start heavy chores or lifting. Okay, so I know that as a mom, we want to tidy up our house, carry our babies, our older babies, right? Keep the house clean, cook, bathe our babies, lift things up, arrange the house just to make sure the house is looking clean and sparkling neat. But I need you to know that your pelvic floor is still very weak. Your stitches are not even healed yet, and your uterus is healing. It takes time. Okay, your stitches can end up getting opened again, which will require you going back to be restitched. That is not funny. So avoid sweeping, avoid bending for too long, avoid lifting heavy objects, avoid long hours of standing. All right, so take care of yourself first, your body first, all right, before every other house chores. Give your body time to heal. 6 to 8 weeks or even more for some women is needed. Just make sure you're healed. Feel it. Okay, feel that you've healed before you start any other thing. Okay, don't care about what people say. Please, you yourself, everybody is different. Every woman's body is different. All right, number 3 is do not have sexual intercourse just after giving birth. A lot of women do not want to hear this, or some people don't like hearing this, but the truth remains that your body is not ready for sex. Okay, so just after giving birth, your body is not prepared yet, because your cervix is still very tender, your vagina is still trying to heal, and your uterus is still raw inside there. It's still very raw inside here. Okay, mind you, it's a part of your uterus that the placenta is attached to, and it pulled out from that. It's still very raw and open. It needs to heal. It needs what? Time to heal. So don't rush into having sex early, okay, because this can expose you to infection, severe pain, tears, and mind you, if you've had stitches and it gets open or it tears open, you probably will go back to the theater to be resutured. And believe me, that pain you felt during childbirth, it will becloud the pain of the stitches you get, even though you had some anesthesia given, right? Maybe local anesthesia given. But believe me, if you go back to be resutured, that pain will be high. It will be higher than that day you had your baby born. And for some people, they have to undergo general anesthesia to be resutured. So I have a friend that had her stitches loosened. Okay, something happened and then the stitches went off. It wasn't sex actually, but she had to undergo another procedure of restitching under general anesthesia. So it can happen to anybody. So that is why you should not think of having sex first just 3 days after giving birth. Most doctors recommend 6 to 8 weeks, okay, before you even think of trying any sexual intercourse or sexual things, okay? Even though the body differs, some women can stay longer than even 8 weeks before they feel better, some 3 months, yeah, before they think of having sex. So please take time, okay? Back again, take time, let it heal first before, you know, ask your partner, get them to understand your body, okay? So that they don't feel offended at the same time. But the truth is, they should understand actually. Okay? So don't do that, don't rush. Please have a lot of time for that, okay? Number 4 is don't skip meals and don't forget to hydrate yourself. Okay, so in the first few days of delivery, some women feel very tired or even overwhelmed to eat or drink. Okay, the thought of having a new baby, especially first-time mothers, it quenches the urge to eat and the thirst for water. When I had my first baby, I just couldn't help it. I was just looking, I said, am I a mom? So I'm a mom. Am I a mom? So I'm a mom. Like, the joy was too much that I told my husband, I don't want food. Just take that food away from me first. Wait, when I'm ready, I'll eat. Okay? I'm not hungry yet. I'm not hungry yet. I'm not hungry yet. And because I think I was overjoyed, I was over happy. I was too happy that I didn't feel like eating anything. After some hours, that was when I felt like, okay, I need to eat something. I think I was even pressured to eat something. So some women, the trauma they pass through giving birth, some women, the joy they get after giving birth to a baby can make them not to feel hungry or even want to eat anything or take anything. So do not skip meals or fluids, okay? Because doing that can delay your healing, okay? Your body needs to heal, so it can delay your healing, and also it can reduce your breast milk supply, and it can make you weak and dizzy. So please eat a proper balanced diet, drink a good amount of fluid, most especially water, because the truth is this is what your body needs the most, okay? Immediately after childbirth or a couple of days or weeks after childbirth, all right? Another one is do not overthink your baby's sleep. Newborns or new babies sleep in short cycles. That is normal. Don't stress yourself thinking that your baby must sleep a long hours after childbirth, okay? Because I know that your body needs rest too as a woman. That is a period sometimes we want to sleep long, want to relax, want to chill out. We've stressed ourselves carrying the baby and then pushing that baby out. So our body needs rest actually. So we also want our babies to sleep long so we can rest. But sometimes it doesn't work that way. So do not overburden yourself thinking that, oh, why is my baby not sleeping long? Why is she always waking up? Why is he sleeping just 20 minutes, 10 minutes, 15 minutes? Don't do that, okay? Don't overburden yourself with that thoughts. Avoid comparing your babies with other babies. No, because some of us have friends too that must have had babies before we did. So do not compare your baby with other babies. Do not do that, okay? Just avoid that, okay? I was there. My baby does not sleep. I don't know, and I kept calling my friend saying, why is this boy not sleeping? Does your baby allow you to sleep? And she's like, yeah, he sleeps. I was like, oh my god, there's something wrong with my baby. Something be wrong with my baby. And that thought keeps coming to my head. I'm like, why are you not sleeping? But to cut the story short, my baby sleeps well now, yeah. So just don't bother about that. So just ensure that your baby eats well, they feed well, okay? Ensure that they have wet diapers. That means their digestive and excretory system is functioning well, okay? And your baby gains weight. All right, so once that is okay, with time they'll get back to sleeping or having a good sleep pattern. All right, so every child is different, so don't like bother you. All right. Number 6 is do not neglect your stitches or your wound care. Okay, whether you had a tear, C-section or episiotomy, every stitches, every wound needs proper care. Avoid touching that area with dirty hands. Okay, don't go down there with your hands dirty. Don't go down there with your hands dirty. No, before anything, before touching that part of your body, okay, that has the tear, the stitches or the wound. All right, so do not ignore foul smell, abnormal smell. Okay, once you notice that that place is beginning to smell somehow, or for people that have C-section, if you notice that it is pussy or it's beginning to drain some fluid that is abnormal, that is smelling bad, or even your vagina is beginning to discharge some kind of mucus or some kind of discharge that is not healthy, it is not a good one, okay? And it also needs an urgent care immediately. So do not ignore that, okay? Be aware, be vigilant, observe that place properly. Do not wear tight underwears, do not wear tight shorts, okay? Do not put pressure on that part of your body that needs to heal. If you notice any redness, fever, discharge, or any abnormality down there or your C-section, please contact your doctor as soon as possible or your midwife, okay? So that the proper management and treatment can commence immediately. Probably it is infected, right? Okay. So number 7 is do not use waist trainer immediately after giving birth. So I know that a lot of we mothers, we want to snatch back, We want our body to go back to how it was before, because childbirth will actually sometimes, most times, push your tummy out. We want our tummy to go down fast. All right, we want it to snatch back. We want to look hot as we used to look before we got pregnant. But using waist trainer too early can cause a lot of harm to your body, especially for people or women that underwent cesarean section. Okay, so these waist trainers can put pressure on your incision site. Okay, that is where the knife went through. Okay, and also it's too early. Okay, so it can actually also put pressure on some organs in your body that might displace them from being where they are supposed to be. Don't forget, your baby actually took some space in your body, which means it dislodged some organs. Okay, and when it is out, every organ needs to go back to where it used to be. That's the normal setting, and then immediately you're already putting a waist trainer. That's a stress already. Okay, so a waist trainer can cause misplacement of your organs. Definitely causes pain. Yeah, it causes pain because your body is healing. It's not yet healed, so it needs time, and it can also restrict your breathing. You start struggling to breathe. Your body needs rest and not another stress, like you're choking up. So avoid waist trainers immediately after giving birth. It's very, very essential. Take your time to heal first before you start with this. Your body will still go back. Okay, it will go back, and if it doesn't go back, it's for your baby. You brought forth a life. It's not easy. What is more of a blessing than that? Come on. So don't pressure yourself too early. Okay. Number 8 is do not stay in bed all day. Do not stay in bed all day. After giving birth, your body needs to rest. Your body needs to relax. All right, rest is very, very important. Please don't take that for granted. Okay, yeah, because I'm repeating that. Do not take that for granted. But too much lying down can cause blood clots, and also it can impair healing. Okay, it can slow down your healing. So you need to move around. You need to exercise a bit, not actively, passively. All right, so that everything in your body can move normal. All right, so that your body doesn't go dormant. You need to be active because you're living. You're a human being. You're an active person. There's life in you, so your body should also express what life is. Okay, so don't keep lying down all day long. Stand up once in a while to move around. Just walking around your house is enough, because a little movement can actually increase circulation and also can lighten your mood, so that you don't move into postpartum depression. So try stretching, stretch your hands, stretch your leg, stretch your back, your neck. All right, move around, walk around your garden, walk around your sitting room, your room, and do that slowly. Please don't rush. Don't rush. Even while you're trying to stand up slowly. Do not rush. Do not rush. All right, so try to be active a bit. Okay, don't rush. Try to be active a bit. I don't know why I'm mentioning this again and again. I've seen things. Okay, so please take it easy on yourself. All right, and that brings me to another point, which is do not ignore your emotional health. Okay, while you're attending to your baby, please also remember to watch yourself. Okay, baby blues are real. Very, very real. Baby blues are very, very real. I know the struggle of getting pregnant, the whole struggle, you know, and then you give birth to that baby, the whole struggle. Some women contract for days. Some women went through traumatic cesarean section, traumatic tears, 3rd degree, 4th degree tears that takes time to heal. Okay, some got infected along the way, and all these are stress on the self. Even mentally, it stresses you physically and mentally. And some women actually had a lot of changes in their body that still drains them. You know, when they wake up and they stand before the mirror, what they see is not what they want to look like. There's a lot of stretch mark, a lot of scars, a lot of hyperpigmentation, a lot of changes, saggy boobs, heavy eyes, black under eyes, a lot of dark patches, a lot of, some women even suffer eczema. Yeah, a lot of things that comes with giving birth and pregnancy. A lot. So they are real. Okay, and this can actually affect you mentally, can affect you emotionally. It can ruin your health. Can ruin your mental health actually. Yeah, it can. So if you feel this persistent sadness, this constant sadness, you're having a baby near you that should, you know, make you excited, like, oh, I have a new life, I have a new beautiful baby. Look at her nose, look at her nose, look at her mouth, look at her teeth. Baby does not have teeth. Okay, you know, all those features that can make you excited, and you just notice that you're constantly sad. It's not a good one. Okay, if you notice that you're constantly sad, you're having this severe anxiety, you're paranoid, sometimes your heart is skipping, your breath is hard to catch, you're crying daily, you're feeling disconnected from your baby. There's a lot. Yeah, I remember the friend telling me that she just wanted to kill her baby. Like, she just wanted to hold the baby's neck and squeeze life out of him. Like, she just wanted to hold the baby's neck and squeeze life out of him and let her just have peace, that she feels like he's now a burden to her. And I'm like, that's serious. That's very serious. Like, so if you're having all this, okay, you might be having postpartum depression, and it's not a good one. No. Or even postpartum anxiety. It's not a good one, actually. So please contact your doctor, your health physicians. You need to speak to a therapist as soon as possible. Please don't take it for granted, so that you don't do something that with time you regret, or you yourself, a lot will happen to your life. Because there's no how you do something that is abnormal to your own baby or to yourself and you feel happy with time. It will break you, but it will be worse. So please speak to somebody as soon as possible. Talk to your partner so that you can also contact a doctor or somebody else, or even your mother can come around, your sibling, your family and friends, people to share or people to lighten up your mood. It is necessary, very, very necessary. Okay, your mental health matters as well as your physical health. Okay, don't joke with any of them. All right, this is me sending love to every woman out there. You being a mother is a big thing. Okay, you being a mother, you've done so well. It's not an easy task. I've been there. I know. Okay, so don't allow those things weigh you down. Speak to somebody as soon as possible. All right. And number 10 is do not compare. A lot of moms make this mistake. Do not compare your postpartum body with any other person's body. Do not compare your postpartum body with any other mama's body. You people are different, okay? And each childbirth comes with different body changes. You might notice that some mothers after giving birth, or some women after giving birth, snap back immediately. Their body gets back together. They don't get fat. They don't get too slim. They're just okay. They go back to how they used to be. Just maybe 1 or 2 little changes, okay? Yeah, it happens. So, but yours is different, okay? And this is me telling you, avoid it. Avoid stressing yourself with it. Avoid thinking about your belly size. Avoid thinking about the dark patches, the hyperpigmentation, the stretch marks, the saggy boobs, the impairment. Even some people, their gum starts bleeding. Some people lose teeth. Some mothers lose their teeth. Yeah. To childbirth. So don't compare your body. Don't compare your body with any other person's body. Don't feel bad about it. Okay. Give yourself time to heal. Healing is not a race. Nobody gets first. Nobody scores number 1. Nobody is on the top list. Everybody is moving. We are progressing. Okay. Your body might take. This person's body might take 6 weeks or 6 months to heal. Yours might take 2 years. It's your body. You can't change it. Okay. So take time. Don't rush. I don't even know how to explain this. Give yourself time to heal. Don't be pressured. Don't allow people come around to tell you, oh, after I gave birth just 2 weeks, oh, I snatched back. You need to see me. No, I'm happy for you. Man will heal with time. Don't let them pressure you, okay? So many people will come with their own stories. So many women will come with their own stories. And believe me, not everybody's stories are real. Some are just making it up. Some are just trying to fight their own impairment too. And then you think all are rosy in their body. Not all, okay? Some don't feel the way they actually expressing it. They just don't want to. They're just trying to patch their own life. How am I going to explain this? I know a lot of that, okay? So please just bear with yourself, bear with your body. It's your body. It's not any other person's body. It's yours. So deal with it, okay? Give it time. It will heal. You will get back. And if you don't get back, I keep saying it, if after giving birth and you don't get back to who you used to be, like body-wise, physically, just it. Yeah, you didn't just get those body because you needed to get them. It happened because you're trying to bring a life. And there's nothing worth more than that. It's your own win. When you look at that baby, tell yourself, this body is because of you and I'm proud of that. And accept that with your full chest. Okay? Just focus on your baby. Focus on yourself. And win. That is all. Alright? Don't forget, everyone's body is different. Everyone's body is different. It takes time to heal, actually. And so, mamas, these are the 10 things you should not do immediately after giving birth. Okay? Your postpartum season is a time for healing, bonding, adjusting, accepting. Okay? It's not a time to mount pressure on yourself or to stress yourself. No. It's a time to relax, chill. Okay? Remember, your body deserves patience. Your body deserves peace. Your body deserves love. Your body deserves care, just as the baby also does. Okay? do not bother yourself a lot, okay? Time will come and everybody will be all right, including you and that baby. All right, if you find this video relatable, please hit the subscribe button, like, subscribe to my channel. You can share your own stories and some changes you notice in your body, and also how you healed after your postpartum. Please share this video out there too with people out there, new moms and moms to be, and I'll see you in my next one. Thank you so much for watching. Bye.